Okay, so today we're here to talk about GERD. It is National Awareness Month for GERD, and I would like for you to go ahead and introduce yourself if you would.
Absolutely. So I'm Abdullah Abdussalam, MD. I am a gastroenterologist at Texas Health Medical Associates, based out of the new hospital that's opening to Texas Health Mansfield on Lone Star Road. So we're going to start seeing patients there pretty soon. But I am already seeing patients here in Mansfield. So anybody who's interested, feel free to give our office a call.
Okay, excellent. So just so everyone knows, I think a lot of us have heard of GERD, some of us have not, but what does GERD stand for?
So GERD stands for gastroesophageal reflux disease.
Okay.
And basically, the most common symptom associated with it that people refer to is when they get heartburn.
Okay.
That's usually related to GERD, but there are a lot of other symptoms that people may not realize are associated with GERD that can include things like trouble swallowing, painful swallowing, chest pain even, things like that. But it's also very important to be careful when you have chest pain. You don't want to blame it on GERD because obviously it can be something more serious like heart disease, and so you definitely want to discuss that with your doctor.
Okay. So what is GERD exactly? So I know you say acid reflux, but what actually happens in the body that
So what
creates it?
happens is, acid is normal to have in the stomach. It helps you
Right.
digest your food, and when that acid goes up into your esophagus, that is GERD. So that's what it's refluxing up into your esophagus.
Okay.
And so when you have acid in your stomach, usually it doesn't cause these symptoms. It's supposed to be there. But when it gets up into your esophagus, that's when people can get those other symptoms that I was talking about, like the burning and sometimes trouble swallowing and things like that.
So what causes it? I mean, what makes that happen, that reflux?
So there's a lot of things that can cause it. So basically, there's a muscle that divides the esophagus and stomach, and it's supposed to prevent that acid from going up, and it's supposed to relax when you eat, right? So that your food can pass by, because you don't want that muscle blocking both directions. It's supposed to be kind of a one-way valve. Sometimes that muscle can get kind of weaker or looser, and so when that happens, things can slide up more easily. It's supposed to relax once in a while to, like I said, allow you to eat. But if it's relaxing too much, then you can get acid reflux and heartburn.
What causes that muscle to relax? Is it just over time?
It's just over time, yeah.
Okay.
Your neurologic system is supposed to cause it to relax intentionally, as I mentioned, obviously, because you want to be able to swallow without having things get stuck.
Right.
And then sometimes that can misfire or happen excessively. And another thing that can happen that some people may have heard of called a hiatal hernia.
Yeah.
So a hiatal hernia is related, and it's related to that sphincter as well, because what a hiatal hernia is when the stomach slides up a little bit into the chest instead of being down in your abdomen. And so if it slides up a little bit, there's not as much of that sphincter becomes even looser. And so it's not as tight anymore, and so that can cause more heartburn as well.
Wow. Okay, that sounds scary.
Well, it definitely can cause troublesome symptoms.
Yeah.
That hiatal hernia is not usually something that's dangerous, but it can definitely be troublesome.
So how do you know the difference between GERD and just the occasional heartburn?
So even if you have just occasional heartburn, it probably is most commonly related to GERD. But if it's just occasional and it's not really giving you any trouble, you may not really need to do much about it. I will say myself, I probably have occasional heartburn when I eat trigger foods. Okay. So things that you may think of as trigger foods really are. So things like fatty foods like pizza or burgers, chocolate, caffeine, alcohol.
All good stuff.
All the good stuff. That tends to cause people heartburn.
Okay.
I'm no exception. I get heartburn when I eat those things. And so, but if you get it not too often and it's really not that bothersome, you probably don't need to do a lot about it.
Okay. And if you have it and you have it all the time and it's not heartburn and it is GERD, what happens if you don't take care of that?
So if you don't take care of it, well, it can just cause lifelong troublesome symptoms. That's probably the least worrisome outcome if you just have troublesome symptoms your whole life. But it can also cause other complications. So complications from long-standing heartburn and GERD include, so that acid that keeps washing up into your esophagus, it can damage the mucosa in your esophagus because your esophagus is not supposed to have acid in it.
Okay.
And so that damage can cause a stricture and make it difficult for you to swallow from a narrowing. But also constant inflammation from that acid can rarely lead to cancer.
Wow.
Yeah.
Okay. So it's definitely something we need to
It's
be.
definitely something to be vigilant about and take care of.
So if someone thinks that they may have GERD, how do they find out? How do you diagnose that?
So it's something I would discuss with your primary care doctor if you think you
Mhm.
might have it. Certain people may warrant more intervention or investigation about it if you have particularly worrisome symptoms,
Mhm.
like things like weight loss, things like anemia, advanced age tend to be more associated with worrisome findings. On the other hand, if you have a younger patient who really just has mild symptoms and they take some over-the-counter medicine and feel a lot better, well, that's might be good enough for them.
Okay. And so the long-term treatment. So if it's been diagnosed, how do you fix that? How do you prevent that?
Really, there's three main treatment options.
Uh-huh.
So option number one is what we call lifestyle modifications. So doing things to avoid the symptoms without having to take medicine. So that includes avoiding trigger foods. So we already talked about that. Things
Yeah.
like fatty foods, caffeine, things like that. Second thing is losing a little bit of weight. Usually 5 to 10 pounds is probably enough to make a big impact on symptoms. Yeah,
Wow.
because really, so what happens is, and it's pretty simple, you know, if you have more weight in the belly, it's kind of pressing on your stomach and pushing things up. And so if you lose about 5 to 10 pounds, usually we say 5% of your body weight, then that may be enough to give you relief. It may not get rid of your symptoms altogether, but it'll give you relief. And then other things in lifestyle modifications include things like sleeping with your bed upright. Again, gravity's helping you, so preventing things from coming up. And avoiding food or drink 2 to 3 hours before bed, because when you lie flat, if right after you eat, then things can easily reflux.
Yeah. Okay.
Option number two is medicines. So medications like Pepcid, also known as famotidine, or Prilosec, also known as omeprazole. Those are common medicines used for the management of GERD.
Okay.
And then the last pathway is surgery. So somebody who's been diagnosed with real GERD, they don't have any other, they're a good surgical candidate, they don't have any complications from it, they may be a surgical candidate to try to get rid of their symptoms for the long term.
Okay. So how common is the problem?
It's pretty common. I'd say it affects about up to 20% of Americans.
Wow.
Yeah, so it's definitely something that a lot of people have, and many people may just, after they have a slice of pizza, may, feel like they're having some indigestion or heartburn, and they just try to give it some time and take some Tums or something over the counter until they feel better. So not everybody seeks medical advice for it, but it's definitely something that I would discuss with your doctor.
Okay, excellent. Well, thank you so much.
You're welcome.
I appreciate the time. Great information, and we'll send folks to you.
Sounds great.
All right.
Thank you for having me.
Thanks.